Good evening. Good evening. How are you guys doing? Minister Jinjin coming to you live on tonight. I do apologize. A little late on tonight, but just had to excuse me. Just 1 second. I'm sorry. Okay, I'm back. I'm sorry. I don't know how to take that happy Thanksgiving off and everything. I have to speak with Bishop on that later. But how y'all doing? How you doing? Minister Jinjin coming on to tonight. And just today, excuse me, I'm here. I will be speaking about World AIDS Day, which was just this past Monday on December 1st. But um as I told you on Sunday, I will be presenting that and talking about that. Um, so let's get into it, y'all. So I have a few facts and just because I know people really don't like talking about this disease as much or whatnot because they call it the scary disease and everything, which it you can become scared or whatnot if you don't know your status or whatnot, but you also know what you're doing too. So let me say that. Um, and so tonight, again, I'll be presenting World AIDS Day, which was on December 1st. The theme for this year, for 2025, for World AIDS Day is um, overcoming disruption and transforming the AIDS response. The theme of this year in 2025 for World AIDS Day is overcoming disruption. The global community stands out at a moment of both possibilities and apparel. For decades, the progress meaning the world has the tools to experience to end AIDS as a public health threat. Again, remember I was saying that everyone thought that just talking about the disease was tremendous, and then I know back in the 80s and 90s they were saying that it was just a gay disease or whatnot, but that's not so true. um it's more to it. I can tell you that, and with the research far as or just listening to documentaries and everything of that sort for years. I mean, it didn't the United States didn't first have it here, it came here. So that's that too. Because it was first shown. I seen two countries. It was France and another country. But I'm just letting you know it wasn't first discovered in the United States. Um, and if I'm wrong, please correct me. But if what I've watched before in documentaries, that we weren't the first ones to have it, but it was a gentleman. And I even think that I even presented a gentleman that did have it, but here, there. Let me go on. The AIDS slash HIV Prevention and Control Act in 2017 safeguarded the rights of people living with HIV and to prohibit discrimination because everyone, when they find out someone has this virus or this disease, they think they can catch it, or they can catch it through saliva or by touch or whatnot. No, you can only catch HIV/AIDS through bodily fluids, um, and blood. If if you got a cut and the person that's infected has a cut and you touch each other, then yes, you can get infected that way. But I'm glad this act passed. I didn't even know about this act that passed in 2017. Um, and also, it does have a ribbon. Everyone knows that the AIDS awareness, HIV AIDS has an awareness ribbon, which is the color red. You know, I love my ribbons. And because it's past for World AIDS Day, I say wear your ribbon or wear the color, and the color is red. Wear the color red for the month of December for World AIDS Day awareness. Got my red lipstick on, which Minister Ginger always have a red lipstick, but sometimes I switch up. But show awareness for people that are living with this disease. Um, the Red Ribbon, which was created in 1991 by artists for the Arts of Organizations Visual Aids. Again, wear it all month long. Wear red ribbon, wear red sweater. Show your awareness. Show your support. In 2022, I have some. In 2022, 1.3 million people were newly infected with HIV. I'm not sure if you guys heard on the news locally, if you live in the DMV area, that um, here in the DMV area, it was on the news yesterday that new findings, new research, that over 8,000 people in Prince George's County, Maryland, have been, these are new cases, are living with HIV AIDS virus. Okay. And on the news, it said 8,000, but when I was listening to the radio say 8,600 and something, but that's close to almost 10,000 people in the county. And the county is not that big, but I stress this enough. Protect yourself. If you're doing unprotected sex, think twice, because this disease is not going anywhere right now. I mean, I know they're doing research and everything, but please be safe for you guys' health or whatnot. Please use protection. That's a high number, and they said the ages are from I want to say 18 to 39. 8,000, a little over 8,000 people in Prince George's County, Maryland, are infected with this virus and other STDs. I stress that enough. Or don't do anything at all. How about that? Don't have sex at all. But if you do, please protect yourself. Um, Another way of you protecting yourself is knowing your status. Always know your status. Always get tested every 6 months. Or some people say, well, the thing is to get tested every 6 months. But some people get tested maybe a little more than that, maybe every 3 to 4 months. But if you were exposed, then they stress to get tested right away, and then you get tested again a couple months later. The world is committed to ending this AIDS. The world is committed, and they pledge to commit to ending AIDS by the year 2030. Rates of new infections and deaths are not falling rapidly enough to meet that target. So again, know your status, protect yourself. How do you show awareness? Like I said, you can wear your red ribbon, you can wear the color red, you can organize health fairs with free testing and educational talks at these health fairs. And so people know the facts, because some people think you can only get it by touching, or it's the gay disease, only gay people get it. But no, everyone can get it. No one's obsolete from it. But again, be safe. It says hosting a candlelight for someone that you know, or a loved one, or a family member that lost their life through this virus, through the AIDS virus. And it said candlelight visuals, or to remember, or remembrance of people that lost their lives, and also survivors, because it's I mean, it's not a death sentence, but it's not a death sentence. But you can have a candlelight vigil about survivors as well, and then they can even or visual or memorial, excuse me. They can even inform people that aren't infected to better, so they won't discriminate against someone that is. Um, Hold a fundraiser. That's good because then you can donate the money to research. Hold a fundraising event and like a charity. Do a 5K walk. You could do a concert or a breakfast. Organize something of that sort. Um, while also to bring awareness, you could do online, like using social media like Instagram, Facebook, Twitter. I don't know if Snapchat still goes on. I know I'm showing my age. Minister Ginger showing her age, but I'm not sure if Snapchat is still. But I know these youngins, these YNs, they're not they're not using. I don't think Snapchat. So you can use excuse me, like hashtag World AIDS Day and hashtag Stop HIV Together. Um, Also, do a mural project if you know artists, or if you're an artist yourself, you could do a mural on a wall or in a painting, or use a canvas um, to show awareness of people for people with this disease, and anyone could wear this ribbon. And so, and last fact I have as far as statistics, globally, about 39.9 million people are living with HIV, the HIV virus that causes AIDS, including about 1.2 people in the United States. That's a lot, you guys. That's a lot. And remember, I said this is World AIDS Day that was just passed on Monday, December 1st. So I want to come to you to again to inform you the statistics, and I told you, as I told you, I was going to talk about this today, but then it really stressed me to talk about it really tonight because of what I heard on the news this morning. That I seen it first on social media, and then I heard it on the news at 12 or whatnot, and that's a lot of numbers for PG County. And then they had a specific area as well, but um, which was Oxon Hill and Forest Heights, and that's a small little town, not too far from here. So, um, and I stress get tested. If you don't know your status, get tested. If you haven't gotten tested in years or months or whatnot, I mean, don't go on WebMD and read all the symptoms. Oh, I got it. I think I got it, and this and that. No, just go ahead and get tested. It's a lot of places that give free testing. You can even go on your local, because I did hear on the radio news that you can go on Prince George's County, or maybe wherever you are in your town or county or whatnot or state. They have free tests that they can mail to you, because I know that's what they were saying on Prince George's County, and even DC does it as well. When you go on DC Health Link, and they'll mail you a free HIV/AIDS test, or you can even buy one in the store, and it's a rapid test, and you can find out in how many minutes or whatnot, which are 99.9 accurate. But if it's invalid, the test results are invalid. Hi, Sister Rickenbacker. Thank you for joining in. If the tests aren't accurate, then it's suggested to you can go to your provider, or you go to the ER, or go to the lab, or research and see where you can go in your city or town where you can get tested. And also just not just AIDS, if any other transmitted diseases or whatnot, because those numbers were high as well. They were saying as well. I'm not promoting, section or whatnot, but I'm just keeping a Minister Ginger, just keeping it real. Just know your status and be safe. And you never know, like I'm not trying to scare you guys either. I just want to bring awareness because, like I said, no one wants to ever talk about AIDS or HIV because it's scary to them. I mean, we talk about cancer or whatnot, but we we watch people watch loved ones die from this disease. So I stress enough. Oh no, I know some people that do have it, but I stress this enough. Don't discriminate. If they do have it, don't discriminate against that person or whatever or whatnot. Because again, if you don't know your status and you may be walking or sitting next to someone that has it and you don't even know, because they have so many drugs nowadays now for patients that have the HIV AIDS virus, and they have so many tests, I mean medication that keeps their levels. I forgot the level, the name for the levels, but I do apologize. They have so many medications that keeps you healthy and keeps your immune system up and everything. But why go through that instead of that? Just keep it safe. Don't do nothing at all, or if you do decide, be protected. Protect yourself. Or if they want to, oh no, I'm good. I just got to, no, don't believe them. No, 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 no. Get tested. Know your status. So, and I know in some states, even before you get married, they make you do a test before you get married or whatnot, if I'm not mistaken. But again, that was years ago. I don't know if it's mandatory now. But you agree, right, Sister Stephanie? So I just wanted to bring forth that, and because we all God's children, you can't say, "Oh, I don't want to talk to them," or "I don't want them to touch me," or you can't get it through your toilet. You can't get it through the same spoon or anything like that. Because I'm sure everybody goes to restaurants and everything, so you can't get it that way. So please don't be ignorant to the fact of the disease. If do like how I did, research it and the facts and the numbers. And if you don't know, and like I said, if you can go and read up on it and or on a pamphlet or someone that does have this virus, you can even ask them questions. Um, so I just wanted to come to you tonight. And Mr. Ginger, I hope I was very informative to you. And I stress be safe out here and know your status. And so hashtag, what I say? What was it to be on social media? Hashtag World AIDS Day and hashtag Stop HIV Together. Know your status. And y'all be safe. And I love y'all. And I'll see y'all on Sunday. And toodaloo. Love y'all.
Bye bye. I was watching the whole thing.
Yes, you don't know these days, Sister Rickenbacker. You definitely don't know. So it's best to know your status. Like I said, you can go to your nearby clinic, find out where you can go get it free testing. They do rapid testing, and if they draw your blood, it takes 1 to 2 days, and they'll let you know. And it's all it's all discreet by law. They cannot tell anybody your results. They can't tell anybody your results. And so signing off. Love y'all.
Bye, guys.